On this Monday night, the consequences for Canada of Pfizer's vaccine production reduction.
That's going to be a massive, massive impact.
How provinces are coping with a shortage of shots. COVID-19 rages through an Ontario care home. The fears the new variant is to blame. The next U.S. president's plan to kibosh Keystone XL. The ramifications for Alberta and what it means for Canada-U.S. relations. And pro athletes bouncing off the walls.
I don't think I can swing my racket in this room.
When competing requires quarantining and creative ways to train.
Global National with Donna Friesen.
Good evening and thanks for joining us. We begin tonight with the pressure building on Canada's healthcare system. A delay in promised vaccine doses is coupled with concern about how quickly new, more contagious variants of COVID-19 are spreading. At least 25 cases of the highly transmissible UK variant have now been detected in Canada. Most are in Ontario, where 15 cases have now been confirmed. The latest one is not linked to travel. That is evidence it's spreading within the community.
This is concerning to all of us, especially as the data indicates that this variant may be spread about 56% more easily than other variants.
And that could change the game. There is no evidence the variants make people more severely ill, but because they spread so much faster, the case rate could skyrocket. Hospitals already over capacity would need help. Today it was announced a newly built hospital in Vaughan, Ontario will act as an overflow, providing 185 additional beds, including over 35 spots for people needing critical care. It's expected the bulk of them will be COVID patients.
With many of our hospital ICUs approaching full capacity or beyond, this new hospital, it's relief. It's added capacity for all those heroes who are stretched to the limit right now.
That new hospital, though, doesn't open until February 7th. Contingencies also have to be made for the shortage of Pfizer-BioNTech vaccines. Alberta now says it will be out of doses by tomorrow. As Abigail Bimman explains, all the provinces are coming up with strategies on how to cope.
Just hours after Toronto's first mass vaccination centre outside a hospital opened Monday,
we have now been advised by the province that we will only be able to operate this proof of concept clinic for an initial 5 days.
They're now cancelling appointments due to the Pfizer-BioNTech vaccine delay as the company works to ramp up production in Europe.
Very disappointing to all of our city.
That's going to be a massive, massive impact.
Ontario stopped reserving doses after coming under fire. Now,
do we wish we would have held back a little more? Sure we do.
In Ontario, the focus remains on vaccinating long-term care residents, staff, and essential caregivers, while Alberta announced it finished all long-term care home vaccinations.
I believe makes Alberta the first province in the country to complete the first dose vaccine rollout for this important and highly vulnerable population.
But due to the Pfizer delay, Jason Kenney announced they're not booking any more first dose appointments. First Nations and Métis people over 65 and all seniors over 75 are next on the list. They'll now have to wait.
I'm deeply disappointed at the situation that we are now facing.
Thankfully, we did not need to cancel any appointments.
A vaccine super site opened Monday in Brandon. Manitoba officials spent the weekend crunching numbers and believe they can schedule another 4,000 appointments province-wide, even with the shortfall.
And we're being told that we're going to be getting about 28,000 fewer doses over the next 4 weeks.
Frustration, too, as the European Union is expected to get back to its regular supply schedule from Pfizer next week, just when Canada is expected to see the biggest lag. In a statement to Global News in response, Pfizer says specific percentage allocations may fluctuate, but they expect it all to balance out by the end of the first quarter. Abigail Bimman, Global News, Ottawa.
The World Health Organization is warning the world is on the brink of what it calls a catastrophic moral failure over equitable access to COVID-19 vaccines. The head of the WHO says wealthy nations have a me-first attitude, and that's leaving the world's most vulnerable at risk.
Ultimately, these actions will only prolong the pandemic, prolong our pain. The restrictions needed to contain it and human and economic suffering.
The head of the World Health Organization says more than 39 million vaccine doses have been administered in at least 49 high-income countries, compared with just 25 shots in one low-income country. Guinea is the only lower-income country to administer any doses so far, using Russia's Sputnik V vaccine. There is concern the UK variant might be behind a severe outbreak at an Ontario long-term care facility, Roberta Place in Barrie, Ontario. More than 100 positive cases have been confirmed in residents and staff there, and the death toll is climbing. Morganne Campbell reports.
Every Monday, Debbie Grigg visits an assessment center to get tested for COVID-19. She does this so she can see her 75-year-old mother, who lives in a long-term care home in Barrie. She lives in constant fear of losing her mother to the deadly virus.
Anytime I see the number come up, I just dread to answer the phone.
Griggs' mother is one of more than 100 residents under lockdown at Roberta Place. At least 10 residents here have died from the novel coronavirus since an outbreak was declared on January 8th. An additional 60 residents have been diagnosed, in addition to more than 50 staff members. 4 family doctors from the area are volunteering their time and assisting with medical care. One of those doctors is Kelly Wright, who believes the virus may be a mutated variant.
And what we've been told in the literature is that that variant is quite virulent, meaning that the transmission rate is quite quick. So, I mean, our clinical suspicion is that it might be that.
The Simcoe Muskoka District Health Unit is currently testing swabs from the facility to determine if the virus is in fact a variant. A variant of the virus is showing up in long-term care homes to the south in Toronto.
The understanding is that they are more transmissible than some of the earlier variants that we were seeing here in Toronto and in Ontario.
While the variant is concerning, treatment and containment options remain the same, according to those working the front lines.
It doesn't change our approach to the disease because the symptoms present the same way and the course of treatment and management of symptoms is unchanged.
The federal government has allocated $70 million in funding for the Canadian Red Cross to help assist homes in need. They have been deployed to Roberta Place. The home has also received support from the Royal Victoria Hospital and Soldiers Memorial in Orillia, assistance that has been welcomed by Gerlette Health Services, which operates the home. While there may be assistance, families on the sidelines feel helpless.
It is very worrisome, it's very scary, and it's very heartbreaking.
Saturday, Public Health administered 71 vaccines to residents and staff. Morganne Campbell, Global News.
The countdown is on to Inauguration Day in Washington, D.C. Joe Biden will take office on Wednesday, protected by the biggest security operation in history. The risk is not just of a repeat of the political violence when pro-Trump supporters stormed the Capitol. There's also fear of a threat from within. And tonight, the FBI is vetting the thousands of troops being brought in to guard the inauguration. Jackson Proskow explains.
In these tense hours before Joe Biden's inauguration, Washington is on edge. A fire near the Capitol briefly triggered a lockdown, forcing the evacuation of the inauguration platform, where a dress rehearsal for Wednesday's swearing-in was underway. The number of National Guard troops deployed in Washington reached 25,000. Those members are undergoing background checks to root out potential extremists in their ranks, a possible threat from within.
In coordination with the Secret Service and the FBI, they're screening all the personnel that are coming in.
All the while, the security perimeter around the Capitol is expanding to the point that spectators won't be able to get anywhere close to Wednesday's swearing-in.
It is a deterrence for people who are going to do bad things. This is to keep people safe and to understand that we are here for the American people.
Objection to counting electoral votes of the state of Arizona.
New video from The New Yorker shows the ferocity of the Capitol siege. The rioters seem to believe they had the backing of Trump and his Republican allies in their attempt to disrupt the Electoral College vote count. Yet on his final Monday in the White House, the president is in seclusion, issuing a flurry of executive orders, doing nothing to end the lie about a stolen election, words that might calm his supporters and a nation on edge. Tomorrow is Trump's final full day in office as president. It's not clear if he'll break his nearly week-long seclusion and appear before the cameras. It's not clear if he'll issue a flurry of last-minute pardons, as many have expected. He spent today issuing a number of final executive orders before he heads off to Florida, which is where he'll spend his time after he leaves office. Donna?
All right, Jackson Proskow in Washington, thanks. Alberta's premier is looking for federal help to try to keep the Keystone XL pipeline expansion alive. It is on life support again. President-elect Joe Biden has long promised he would cancel the permit for the pipeline project, and now it appears it is one of the first things he will do when he's inaugurated on Wednesday. Premier Kenney invested $1.5 billion in the project last year. Now he's scrambling to come up with a strategy to deal with the fallout. Heather Urix-West reports.
A little more than a week before Joe Biden emerged as the presumed Democratic presidential nominee, Alberta's premier placed a bet.
It is a solid bet that will produce a handsome return for Albertans, and it will rescue the future of our energy industry.
A $1.5 billion purchase stake in TC Energy's Keystone XL pipeline, as well as $6 billion in loan guarantees.
It was so much money to put on a project that it was entirely foreseeable that it would be canceled. I mean, that's one of the things that Vice President Biden campaigned on.
Reports that the now U.S. president-elect plans to kill Keystone on day one may not be surprising to some, but Alberta's premier says construction on the pipeline was already well underway.
This is, I believe, without precedent for an American administration retroactively to seek to cancel a piece of infrastructure, this border crossing, that already exists.
By getting pipes in the ground and taking steps to improve the industry's environmental performance, both the Alberta government and the industry had hoped to see the project forge ahead.
The problem is the perception is so strong in the U.S., and Keystone is such a flashpoint that I don't think any of that's going to matter.
But for a premier that campaigned on jobs, economy, and pipelines, the political cost of losing Keystone could be great.
This is another piece of bad news on top of what's been a couple of months of extraordinarily bad news. He's in the basement in the polls. He's the lowest polling premier in the country.
There is a certain irony that the Trans Mountain Pipeline, which was purchased by Trudeau, will be built, and the pipeline purchased by Jason Kenney won't be built.
That is, unless the new U.S. president can very quickly be convinced to change his mind. Heather Urix-West, Global News, Calgary.
The leader of the federal Conservative Party says he is starting the process to remove MP Derek Sloan from the caucus. Aaron O'Toole says he was outraged to learn Sloan accepted a campaign donation from a white supremacist. In a statement today, O'Toole says Derek Sloan's acceptance of a donation from a well-known white supremacist is far worse than a gross error of judgment or failure of due diligence. O'Toole says Sloan, an MP from Ontario, will not be able to run for the party again. The statement also says racism is a disease of the soul, repugnant to our core values. Coming up, the pleas and the pressure. Can anyone save Keystone XL? By Wednesday afternoon this week, the Trump administration will be history and Joe Biden will occupy the White House. A whole new team of people with new priorities will be in charge of the country that's our nearest neighbor. But don't expect a big honeymoon. As Eric Sorensen reports, irritants like Keystone XL are already emerging.
Behind the scenes, the Government of Canada is in contact with the Biden transition team. In a statement, the Minister of Natural Resources reiterated Ottawa's support for Keystone XL, adding, "We continue to make the case for it to our American colleagues." The official opposition is calling on the Prime Minister to reach out to Joe Biden to keep Keystone alive.
Reach into the new U.S. incoming administration and make those contacts and ensure that everybody understands how important this is to the North American economy.
Blocking Keystone would not come as a surprise. Joe Biden and his new climate czar, John Kerry, stood with President Obama when he turned down the project 5 years ago. President Trump signed an executive order to restart it, but Biden's campaign made it clear last year he would terminate it if elected.
We need a unified national response to climate change.
And since the election, Biden has stacked his cabinet with officials who opposed Keystone XL and reflect a massive turn by Washington towards tackling climate change.
Defeating this threat is the fight of our lifetimes.
A decision by Joe Biden is expected as early as Wednesday, after he is officially sworn in. Canadian environmental advocates say it should be viewed as an opportunity for this country to embrace a greener economy.
We have a real chance because this is a president who has said, president-elect who has made it very clear that the climate is going to be on the top of his agenda.
This is not a surprise given that global markets are making it clearer than ever that the jobs of the future are jobs that help us fight the climate crisis, and that's where we need to make investments.
Pipelines aren't the only challenge for Ottawa. Biden is also promoting Buy American policies that could impede Canadian trade.
If it is something that we see as a disadvantage for Canada, Mr. Trudeau will not hesitate to pick up the phone and speak to Mr. Biden and try to negotiate a settlement.
In other words, whatever the hurdles in Canada-U.S. relations, the Prime Minister is expected to have a better working relationship with the incoming president than he had with the outgoing one. Eric Sorensen, Global News, Toronto.
And Global News will have live coverage of the inauguration from Washington, D.C. on Wednesday morning at 11 Eastern, 8 Pacific. Transport Canada has cleared Boeing 737 MAX planes to fly again starting Wednesday. The approval follows a 22-month review launched after 2 deadly crashes grounded the aircraft worldwide in 2019. The planes can fly if they meet conditions, including new software to allow pilots to disable a faulty stall warning. It was central in both the Indonesia and Ethiopian air disasters. The federal transport minister says Transport Canada has diligently addressed all the safety issues. The first Boeing 737 MAX flights are expected to resume in Canada on Thursday. There's a major change to organ donation in Nova Scotia, and it's a first in North America. It's called presumed consent. Most people will be considered a potential organ donor unless they opt out. There are exemptions, including people under the age of 19, those who don't have the capacity to make their own decisions, and people who have lived in the province less than a year. It's estimated the policy could boost organ donations in Nova Scotia by 30% to 50% within 5 years. According to the Nova Scotia government, a single organ donor can save up to 8 lives. 10 people in Atlantic Canada die each year waiting for an organ transplant. Ahead, a hopeful note in an urgent search for miners trapped underground. He has survived a poisoning attempt with a nerve agent, accused Russia's president of trying to kill him, and now Russian opposition leader Alexei Navalny is behind bars in Moscow. Navalny was arrested on his return to Moscow from Germany, where he'd been hospitalized after being poisoned in Siberia with a deadly nerve agent. A number of countries, including Canada, are calling for Navalny's immediate release. He has since released this video on Twitter, calling on his supporters to take to the streets in protest. There is renewed hope for a group of miners trapped 600 meters underground in China. 12 men sent a note up through a wire cable telling rescuers, "Don't stop trying to reach us." They have little ventilation, though. One of them is injured. Rescuers have sent down supplies and established a phone line. The group has been trapped since January 10th after an explosion destroyed exits to the mine. 10 other people are still missing. A California man who lived undetected in Chicago's O'Hare International Airport for 3 months was finally found and arrested for trespassing. The 36-year-old arrived from Los Angeles on October 19th last year and stayed inside the secure zone of the airport. He was apparently too afraid to fly anywhere else because of COVID-19. His stay came to an end on Saturday. It appears he snatched the ID of an operations manager about a week after he arrived. And when 2 United Airlines employees confronted him asking for his ID, they realized he didn't match the picture on it and called the police. Next, how do elite tennis players train for a tournament while in isolation?
You're watching Global National.
The Australian Open tennis tournament is going ahead, but 72 players are going to have to spend 14 days on their own before it happens. They're confined to their hotel rooms after some people on the flight over tested positive for COVID-19. As Crystal Gamansing reports, the strict rules are serving up a dose of reality to the elite players.
All right, done. That was a tough one.
Lockdown workouts may be common, but imagine the world's best tennis players trying to stay fit in their hotel rooms. Canada's Vasek Pospisil and about a quarter of the field at the Australian Open will be relying on quarantine exercises.
Got the bike. That's the Bosu ball. Everything that I did in the off season, which I had 6 very good weeks of training. It's not completely ruined, but it's not the same now.
To stay sharp, players are doing everything imaginable. The number 1 player in the world, Novak Djokovic, is taking a different approach, reportedly demanding players be moved to private homes with tennis courts and reduced quarantine times.
There's no special treatment here. People are being treated because the virus doesn't treat you specially, so neither do we. Strict protocols were attached to the Open and communicated with players to reduce the risk of importing cases.
I would say it's a minority of the players that are kind of kicking up a fuss, but a lot of times that minority are the loudest ones and the most vocal.
2 weeks of isolation was always a part of the deal. Players were to get 5 hours of outdoor training. For those on one of the charter flights with a confirmed case, they're not permitted outside of their rooms. One of those to test positive is Sylvain Bruneau, the coach of Canadian tennis champion Bianca Andreescu. The Canadians are taking it in stride. Crystal Gamansing, Global News, London.
And that is Global National for this Monday. I'm Donna Friesen. We leave you tonight with a scene that's going to make kids across the country envious. Look at this. It's a hockey rink in the basement. Greg Thompson and his wife Amanda built this Calgary Flames mini dome for their kids. It started 2 winters ago as just a rink, but being Flames fans, they since dressed it up to feel more like the Saddle Dome, complete with a homemade jumbotron. They could be in the running for Parents of the Year. Thanks for watching. Hope to see you here again tomorrow. Take care of yourselves. Bye-bye.